According to a report last year, due to the pandemic, many Canadians are passing over proactive cancer screening or diagnosis of potential cancers. This leaves many doctors to believe an increase in advanced tumors and deaths is on the horizon. According to the Quebec Health Ministry, more than 4,000 people who normally get diagnosed last year went undiagnosed. In Ontario, the health minister announced this week the province will add hundreds of critical care beds as COVID-19 infections soar. In the meantime, hospitals have been instructed to cancel elective surgeries except in, quote, absolutely life and death cases. The potential lack of ICU beds due to COVID-19 is causing concerns for those facing other serious illnesses. Here to help us unpack it all is Dr. Abhishek Raut, Medical Director with the Appletree Medical Group. He joins me now. Welcome to Forum Daily.
Thanks so much, Sheldon.
Pre-screening of patients with no symptoms and diagnosis of people thought to possibly have cancer dropped when the pandemic began. What could account for this?
I think this is a great question and a great topic. The preventative health is really affected by quite a few different variables. Age, for example, younger adults tend not to seek preventative health screenings. Health of the patient in general, comorbidities can certainly interfere with that, and accessibility of the healthcare provider. We as physicians, we always push for preventative screenings because it's not very often that a patient would want to do those screenings. It's usually the doctor who recommends them while they're likely there for something else. And this was, of course, all pre-COVID with these challenges. COVID has, of course, added a whole nother dimension, as you correctly mentioned as well, a very different dynamic where the patient at this point was supposed to stay home as much as possible to minimize risk and perhaps not seek out healthcare when they need it there.
Prostate cancer particularly took a dive with fewer biopsies. What would make prostate cancer stand out in your thoughts?
If we look at the screening steps for a lot of different cancers, you see the imaging can be pretty good. For instance, mammograms, breast ultrasounds are helpful in determining risk. For prostate imaging, it's not that helpful actually. We rely on a digital rectal examination and a PSA blood test, both of which, again, are not that great. And so, even then, once we have a patient in one of those flags, we have to then send them to a biopsy. So, prostate cancer is a bit unique where there's so many stages to actually getting properly screened that it turns out to be quite a barrier and likely would be the reason why it's so low here.
Some experts say restrictions by the healthcare system itself is one of the reasons for the decline in diagnosis. What healthcare restrictions currently exist in the healthcare system that could be causing the decline?
I think it's an evolving area. In mid-March of last year, Ontario had actually put screening programs like breast, cervical, and colorectal cancers on hold. And that was just in an effort to pool all the available resources to deal with the pandemic. This is not something that's new to Ontario, so that was certainly a large barrier. The second barrier, of course, is, and the biggest one, is we do have limited resources. Every physician, every hospital bed, every surgery plays a monumental role in healthcare, but all of those need to be redirected.
So if we're talking solutions now, testing numbers are beginning to return to better levels, but certain cancer screenings are still low. How do we fix this?
I think what you're doing right now is absolutely what we need. We need people to know the importance of screenings and put that as an important topic for them. And we need people to understand that their doctor's offices are open and they can see them virtually or in person for those screenings.
What are the long-term concerns over the possible delays in elective surgeries and restrictions due to hospital capacity?
So if we look at just 2020 numbers, we would say that about 44,000 men in Canada would have died from any sort of cancer, and about 39,000 women. What that means is, on average, we have about 617 Canadians that would be diagnosed with cancer every day. And on average, we have about 228 Canadians who would die from cancer every day. So my concern with this is if we really don't reprioritize screenings, those numbers are going to go way up.
I have about 25 seconds for this. Overall, people need to get comfortable with going back to their doctor to get the health issues checked out, etc. 20 seconds for this. What's your advice moving forward?
I would absolutely agree with that statement. Everyone should take 5 minutes today to call your family doctor's practices or book online to get a preventative screening checkup. I think this will be the best and most valuable 5 minutes you'd spend.
Thank you so much for those insights. Definitely appreciate it. Thank you again.
Thanks so much.